Bismillahirrahmanirrahim. Quote of the day: be happy with what you have while working for what you want. Today, the topic of my presentation is health planning, and I am presenting it under kind supervision of Professor Dr. Sarah Afzal. Learning outlines of my presentation are: what is health planning, rationale of health planning, features of health planning, types of health planning, steps of health planning, and in the last planning cycle. And then we would have recent updates and MCQs. Learning objectives. In the end of presentation, participants would be able to describe the features, rationale of health planning, and the steps to carry out it. Now, what is planning? The process of setting goals, developing strategies, and outlining tasks and schedules to accomplish the goals. Planning is deciding in advance what to do, how to do, and who is to do it. It bridges the gap between where we are to where we want to go. It makes possible things to occur which wouldn't otherwise occur. Health planning. According to WHO, the health planning is orderly process of defining community health problems, identifying unmet needs and surveying the resources to meet them, establishing priority goals that are realistic and feasible, and projecting administrative action to accomplish the purpose of the proposed program. Its aim is to maintain and improve health status of a given community. It is achieved through provision of health services which are accessible, effective, equitable, and of a quality to ensure their appropriate utilization. Why planning? The increasing demand for medical and healthcare services in the face of limited resources has brought out the need for careful planning and management of health services. The purpose of planning to match the limited resources with many problems, to eliminate wasteful expenditure and avoid duplications, to develop the best course of action to accomplish a defined objective. Rationale. Planning of delivery of effective health services to the population within resources provided, translation of new policy statement into operational plan, replanning based on an already existing plan for the purpose of reviewing existing health problems and needs and rendering services more effective and efficient, emergence of a new problem like SARS or natural disaster, planning of health services for a population where no organized healthcare delivery system yet or where an existing one is being extremely revised or reorganized. Features of planning. First is a good plan should give clear vision, goal, and objectives, a clear picture of the task to be accomplished, the resources needed to accomplish the task, human resources, material, money, time, space, and information. Planning takes place at all levels. Planning takes place at any level in health system. It takes place continually. It is cyclic spiral process. Planning methods can be applied to like a large program at national level, for example, malaria control program, or small one at village level, for example, construction of community health post. The third is planning must be collective undertaking. It requires the participation of professionals from health and other sectors, community, non-government organizations, government or any party. Now, coming to types of planning, there are two types of planning. Strategic planning, often referred to as allocative planning, and it is for normally 5 years or more. It is for long period of time, the strategic planning. Second is tactical or operational planning. It may be referred to as activity planning. It covers a short period of time or medium term, usually 1 year. Strategic planning. It is a process of determining what an organization intends to be in the future and how it will get there. It is finding the best future for our organization and the best path to reach the destination. SWOT. It stands for strength and weakness, opportunities and threats. It is a strategic planning tool that matches internal organization strengths and weakness, these internal strength and weakness with external opportunities and threats. By reviewing strengths, weakness, opportunities, and threats, a useful strategy for achieving objectives will become evident. In the health sector, strengths may be considered availability of resources and trained human power. Weakness include lack of managerial talent and obsolete facilities. Threats include adverse cultural beliefs towards modern medical practice and growing cost of essential drugs. Examples of opportunities are clear and supportive government policies in the presence of functional health committee in the communities. Tactical operation planning is a short-range planning that emphasizes the current operations of various parts of the organization. Short range is defined as a period extending only about 1 year or less into the future. Now, these are the terms health needs and demands. The purpose of health planning is to meet the health needs and demands of the people. Now, health needs is defined as the deficiencies in health that call for preventive, curative, control, and eradication measures. The needs for safe water supply and sanitation, control of communicable diseases, medical care, including hospital dispensaries and primary health centers, public health services, family planning, adequate nutrition, immunization are all community health needs. In democratic country or developing country, people's needs may be presented as demands. Objectives, targets, and goals. An important element of planning is the setting of clear-cut objectives, targets, and goals. Now, what is objective? It is a planned endpoint of all activities. It is stated in terms of measured amount of progress towards goal. Targets. When the objective is split into discrete activity, it becomes target like number of sputum smear collected or tubectomy done. Goal, an animated desired state towards which the objectives and resources are directed. Goal is not constrained by time, resources, nor are they necessarily attainable. They are formulated at top level and they are generally broad, for example, health for all. Now, planning of health involves three types of activities: assessment of current status, identification of the desired state in the future, specification of interventions and activities to achieve the new desired state. Planning cycle. Planning is a dynamic process. It involves three steps: planning, implementation, evaluation. If no favorable outcome, change the plan, implement, and reevaluate. Steps of health planning. These are the 8 steps. We'll discuss little about it. First is analysis of health situation. The minimum essential requirement of health planning includes the population, its age and sex structure, mortality and morbidity statistics, the epidemiology and geographical distributions of diseases, medical care facilities, the manpower available, training facilities available, beliefs and attitude of people towards health, its cure and prevention. The analysis of the above data brings out health problems, needs, and demands of the population. Establishment of goals and objectives. Objectives are the guide for action. They may be long-term and short-term. In setting up these objectives, time and resources are important factors. They should be SMART, that is specific, measurable, achievable, relevant, and time-limited. Assessment of resources. These include manpower, money, materials, skills, knowledge, and techniques needed or available for the implementation of the health programs. Then comes fixing priorities. Establishing the priorities in order of magnitude of health problems. Prioritization is based on financial constraint, mortality and morbidity data, diseases which can be prevented at low cost, political and community interest. Write a formulated plan. The plan should be complete in all aspects: the input required for the health program and the output expected, cost and time needed for each stage of implementation of the health program, working guidance for all those involved in the implementation of health program. It must contain a built-in system of evaluation. Programming and implementation. Once the plan is approved by policy-making authorities, program and implementation are begun. Now, what is monitoring? It is a continuous process of observing, recording, and reporting on the activities of the organization or project. Evaluation. It is the final step of health planning. It measures the degree to which objectives and targets are fulfilled and the quality of the results obtained. Now, this is the planning cycle that was proposed by WHO according to their 11 steps. I will discuss shortly because these will be discussed in detail in our next presentation by Dr. Isma. First is plan the planning. This stage deals with prerequisites that have to be in place and issues and that have to be resolved before actual planning exercise may start. It is to ensure that planning process can be carried out smoothly. Determines the specific terms of reference of plan. For example, what has to be planned, the purpose of planning, defining target group for what time period, identifying resources available, timing tasks and responsibilities, assigning responsibility to each member. Then second is review of policy guidelines. It is a process of familiarization of government directives and conditions that must be followed in preparation of the health plans to ensure the health plan is in line with government national health policy. For example, National Reproductive Health Package, safe motherhood, family planning, sexually transmitted infections, infant deaths, reproductive health problems of adolescent, reproductive health problems of male, detection of breast and cervical cancer, and infertility. Then comes situation analysis. It is the process of analyzing and interpreting all information available from the various sources on the current situation of the health system as it prevails within the specific geographic area under consideration. The specific purposes of situational analysis are to identify health problems and health needs resulting as a result of these problems, to determine causes and circumstances underlying problems in the health situation as well as for delivery of health services, to assess availability and adequacy of resource in the light of health service needs, and to identify gaps and weaknesses in the healthcare services in line with health problems and service needs. Then comes review of available resources. To assess these would help in determining the scope of the health plan and selection of intervention strategies. These include manpower in terms of number, cadre, gender, and quality of human resource. Then comes material physical resources, including buildings, equipment, and transport, drugs and contraceptives, and dealing with availability and function of these. Money, to see how financial resources are allocated, such as with respect to salary, non-salary, their release and utilization, whether government or NGO financed. Intangible resource information like official documents, policies, goal, objectives and programs, financial reports, approved budgets. Then comes development of interventions. It is the process of identifying, shortlisting, and developing intervention measures from among a variety of potential interventions. The objective is to identify and develop most appropriate interventions for existing health needs. For example, 3 delay model, as we already discussed in our previous presentations. Then comes setting plan objectives and targets. It is the process of defining what one wants to achieve within a planned period of time in the light of earlier identified health needs. The main purpose is to highlight what planners wish to achieve, enable a focused selection of inputs and activities that will bring about these. Now, there is an example to clear the difference between aim objectives. Aim is to, for example, aim is to improve reproductive health services in District Paso. Then long-term objective is maternal mortality shall be reduced from current 340 by 100,000 to 300 by 100,000 within 4 years from 2005 to 2008. This is our long-term objective. Then there is another objective called short-term objective or sub-objective. For example, all pregnant women in all villages of the district are given advice on antenatal care within the first year. By the end of 2007, 80% of women delivering in villages of district will be assisted by trained birth assistants. Now, setting targets. For example, number of midwives to be trained, number of training sessions to be held, number of tetanus or injections to be given, number and frequency of prenatal visits, percentage of obstetric complications seen in main hospital. These are the examples of targets. Then what is our outcome will be coverage of 80% pregnant women with at least 2 injections of tetanus toxoid, 80% of women delivered by trained birth assistant, 70% of women attending antenatal care, 60% of complicated pregnancy referred to and managed at district hospital. The impact would indicate the reduction in the percentage of maternal mortality rate. Now, other stage of the planning cycle is adjusting management and organization system. The management and organization system is the coordinating center for all health service activities. Its main purpose is to ensure maximal efficiency and effectiveness of the healthcare system delivery. Among several functions of the management and organization system, the most important ones address manpower, money, and material issues, and the functioning of the support systems in general. Preparing the budget. Preparing the planned budget is the process of translating inputs, targets, and activity into money. The main purpose is to identify overall financial requirements by plan period and individual year, identifying financial requirements by line item and by specific program, and third is to enable performance budgeting. Then comes developing plan of operations. A plan of operations is the written summary of the implementation plan specifying sequence and timing of and responsibilities for implementation of main objectives, expected results and activities. The operation plan provides a set of ready guidelines for the day-to-day running and periodic assessment of the functioning of health services for the plan implemented. One of the most useful tools in preparation of a plan of operation is the Gantt chart. This is the picture to show Gantt chart. It shows the project task schedule against the calendar. Then comes planning for monitoring and evaluation. It is a quality control mechanism and forms part of management and organization responsibilities. It is important for the success of health interventions. The purpose of monitoring and evaluation is to render healthcare as efficient and effective as is possible, and then determines whether objectives and results are being reached. In the last, we have evaluation. It attempts to determine the relevance, effectiveness, and impact of activities in the light of their objectives. There are different types of evaluation. The main four are process evaluation, formative, impact, and summative. It evaluates how the project outcomes were worked towards and the effectiveness of this process. The impact evaluation is it evaluates the impact resulting from the project and what has changed as a result. Formative evaluation, it provides feedback to the project as to the effectiveness of the methods used to achieve outcomes in order to inform project changes. And the fourth one is summative evaluation, which summarizes what outcomes the project achieved, the impact of this, what has changed as a result, and how it did this, and the effectiveness of this process, and any changes made. Now coming to recent updates. There was a case study on health planning in Pakistan. According to it, despite some strength, the health planning system in Pakistan has generally failed due to the reasons that links between strategic and operational planning have been weak. Decision making has been centralized. There has been a lack of functional clarity. The respective roles of bureaucrats and politicians have been unclear, and links between capital and recurrent budgets and between planning and implementation have been weak. As a result, there are a number of imbalances in the allocation of resources. Then there is another article on strategic analysis for healthcare organization, the suitability of the SWOT analysis. As we already discussed, that it is a strategic analysis tool which stands for strength, weakness, operation, and opportunities and threats. In this paper, 4 case studies are presented on the use of SWOT analysis in different parts of the healthcare sector in the Netherlands. By comparing these results with the premises of the SWOT and academic critic, it will be argued that the SWOT in its current form is not suitable as a tool for strategic analysis in healthcare in many European countries. Based on these findings, an alternative SWOT model is presented in which expectations and learning of stakeholders are incorporated. Now coming to MCQs. MCQ number 1. A plan is framed, it is implemented and is followed by another plan and so on. Which feature of planning is highlighted in above case? Planning focuses on achieving objectives. Planning is continuous. Planning is primary function of management. Planning provides direction. Anyone? Anyone? Any guess? Yes, the right answer is planning is continuous. It is cyclic in process. Second is it was planned that by the end of 2007, 80% of women delivering in village of District A will be assisted by a trained birth assistant. What is it called? Goal, target, objective, sub-objective?
Target.
Target.
No, the right answer is sub-objective. Because it is for a short period of time. The objective is like if we plan that we will reduce maternal mortality rate from 2005 to 2010, then it is the objective. And so it sub-objective is also an objective, but it is for the short period of time. Like by the end of the 2007, our plan is to that 80% of women delivering will be assisted by trained birth assistant. The third is strategic planning is the process of determining what an organization intends to be in the future. It is formalization of planning where plans are made for dash period, indefinite, medium, short, long.
Long.
Yes, right
D.
answer is long. It is for long term, like for 5 years or 10 years. Horizontal bar chart that shows project tasks against a calendar is called milestone, goal, Gantt chart, PERT chart.
C.
Gantt.
Yes, right answer is C. MCQ number 5, it was planned to get 12,000 children vaccinated in District A and 72,000 children in District B. This is called target, objective, aim, goal.
Target.
Yes, right
Target.
answer is target. MCQ number 6. Monitoring is a continuous process of observing, recording, and reporting on the activities of organization or project. Which of the following is not considered monitoring? Counting the number of people trained, tracking the number of brochures disseminated, attributing changes in health outcomes to an intervention, collecting monthly data on clients served in a clinic.
C.
Yes, the right answer is C, because it is not considered monitoring. MCQ number 7. Which type of evaluation addresses that medical providers who received intensive STD, that is sexually transmitted disease training, were more likely to effectively counsel, screen, and treat patients than those who did not? Process evaluation, outcome evaluation, summative evaluation, formative evaluation.
C.
Yes, the right answer is B, because in this scenario, we are evaluating the outcome. That is the difference between the STD trainers and with the non-trainers. MCQ number 8. To what extent have teachers implemented with fidelity evidence-based tobacco use prevention education? The type of evaluation that addresses how well-programmed activities have been implemented is process evaluation, impact evaluation, summative evaluation, and formative evaluation.
B.
A.
Yes, the right answer is A, because in this, because in process evaluation, we see that how well programmed activities are being implemented. So the right answer is A. MCQ number 9. Which statement best describes the relationship between strategic and tactical plans? Strategic plans focus on overall direction of an organization, while tactical plans focus on short-term actions needed to realize that strategy. Strategic plans are focused on outcomes that are at least 3 months out, while tactical plans focus on outcomes that are less than 3 months away. Tactical plans focus on the overall direction of an organization, while strategic plans focus on the short-term actions needed to realize that strategy. There is no relationship between strategic plans and tactical plans.
A.
Yes, the right answer is A, because I already discussed that the strategic plans, they are for the long period of time and they cover overall direction of organization, while tactical plans are for short term time. Now the last MCQ. SWOT is a strategic planning tool that assesses strength, weakness, opportunities, and threats of an organization. Which of the following SWOT elements are internal factors for an organization? Strength and weakness, opportunities and threats, strength and opportunities, weakness and threats.
A.
Yes, the right answer is A, strength and weakness, because the external factors are opportunities and threats, and other are also wrong options. So this is the key. These are the references. Thank you.
Okay, thank you very much.
Welcome.
Dr. Meha, I have seen that you have developed a very good presentation skills over time, and this is how the things have been in a positive and progressive direction. As well as your presentation is concerned, I really appreciate that how you have described different important terms and how you have explained their concept. It is wonderful, especially about planning cycle, SWOT analysis, strengths, weaknesses, opportunities, threats, how to make different planning cycles, 8 step, 7 step, 11 step, etc. We also know that there are certain planning cycles that consist of 25 steps. It depends upon how elaborative are these steps and how we divide further into key performance indicators, strategies, plans, and how the plans are further divided into different outcome measures. As far as your MCQs are concerned, again, a very good effort at your part. If you please go to your MCQ number 2.
Yes,
Would you please read it?
it was planned that by the end of 2007, 80% of women delivering in villages of District A will be assisted by trained birth assistant. What is it called? Goal, target, objective, sub-objective.
Right. As far as objectives are concerned, we know that they should be specific, measurable, achievable, reproducible, and time bound. And the goals are always long term, as you have already described in your next MCQ. The thing is, the sub objective is the part of the objective that is of the importance, but lesser than the main objective that is being given. It is not the right way of giving the explanation that because we have little time to complete this task, so it becomes sub-objective. So this is the explanation is not correct. Your MCQ is correct. The options are correct. Your answer is correct, but the explanation is not correct. The explanation should be that when we have the main objective, it addresses those things that we are focusing on as a priority. However, those things that are not priority, but they are important and they come along as we are achieving our targets and we are heading towards our goal, then certain objectives that are being met on the way. And these objectives are the sub-objectives.
Okay.
I think this concept is
Yes,
clear.
ma'am.
However,
Yes,
at
ma'am.
10 o'clock, we would have a face-to-face discussion, and I will give more details about this planning cycle and how the things they should be given different terms like goals, aims, objectives, sub-objectives, primary and secondary objectives, and targets, and how the targets are further divided into key performance indicators. If anybody has any question, please let me know. Okay, thank you very much. See you all
Thank
at 10
you.
o'clock.
Okay,
Right,
ma'am.
Allah Hafiz.
Allah Hafiz.